Good evening, respected General Manager, Mr. Verma, Madam Verma, distinguished Sarva members, PhDs, doctors, colleagues, ladies and gentlemen. My topic now is become very easier because my previous two speakers have talked about hypertension and there is some repetitions. I will skip that things. Just I'll go something brief. So already Dr. Sengupta has done. So 1 in 3 adults is having hypertension. And 40% of adults aged for 25 and over had less condition. And due to increasing of age, the doctor's incidence also is increasing. So in proportion increases with age, 1 in 10 people in their 20s, 30s, it increased to the 5 in 10 people in their 30s. So this is a very important fact. So my topic coverage is what is hypertension, type of hypertension, signs and symptoms, causes, treatment and care, and some frequent questions, asked questions. So already you know that high blood pressure, it is a medical condition in which constricted arterial blood vessels increase the resistance to blood flow, causing an increased blood pressure against oxygen. Simply put, as a common disorder in which blood pressure remains abnormally high. So here this determinant of arterial pressure is the cardiac output and the peripheral distance. Both are involved for this cutting the arterial pressure or hypertension, normal pressure, hypertension. So this is the arterial lumen. Arterial lumen is the middle is the normal, and when there is so this is the normal lumen curvature. When there is due to the lumen because smaller due to deposition of fats, atherosclerosis or stress, the pressure rises. You can see the normal arterial lumen when the normal blood flow and there is the normal pressure. When there is excessive blood flow with the normal lumen, it becomes hard. Even also normal blood flow, but this is constricted, that is narrowing of this lumen, arterial blood vessels, make the pressure high. So this is the basic mechanism. So there is between agent, there is two, one is the systolic and the other one is the diastolic. Systolics, when there is the constriction, it depends on the constriction, there is the contraction, and the diastolics, when there is the relaxation, there is the rumbling during the beats. So at least 2 beat measurements should be required to stamp whether the person is having hypertension in the different subsequent period. In a week, there should be 2, and there should be mixing of the systolic and the 2 systolics and 2 diastolics, and on average, if it is there, 145, then you can tell this is having hypertension. So that's what I have seen here, that is systole and the diastole, the muscle content. So normal systolic blood pressure, when it is less than 139, systolic, that is normal. And when it is diastolic, one more than 89 is the diastolic blood pressure. This is the normal. So classification already, this is quite important. We know that less than systolic blood pressure less than 140 and the diastolic is less than 80, this is normal. And we require only lifestyle modification, this should encourage. When this is 120 to 139, that is pre-hypertension, they are prone for the hypertension, or near normal, but there it is also no anti-hypertensive required. The same thing you will encourage for lifestyle modification. If it is 140 to 150 in systolic and diastolic 90 to 99, then the lifestyle modifications included. In addition to that, you have to give the drugs. Similarly, more than 160 of the systolic or diastolic is more than 100, then you have to go along the lifestyle modification, you have to give the medication. So hypertension is the 2 types, one is the primary and the other is secondary. Primary happens where the cause is not known. That is most of the contributes to 95% of the hypertension. And secondary causes, that is 5%. 5 to 10%. It may be due to kidney cause, it may be endocrine cause like thyroid disease, and it will be due to drugs like oral pills and other drugs. So what are the signs and symptoms? Usually people do not have the signs and symptoms. They come for some other cause, to the doctor, that time one get the measurement, then we get the because it takes a longer time for us to get it. When you will get it, that time possible that time dizziness, blurred vision, vomiting tendency, headache, drowsiness, nasal bleeding, or flushing of breath, or shortness of breath. These are conditions you will get in the later stage. You may not get those. So for that reason, we should go for the maturity with the blood pressure once in 6 months or like that. Okay. So what are the causes? This is due to high salt. In the pregnancy, there is a sudden blood pressure increases that is preeclampsia. Some endocrine gland, tumors of the adrenal gland, kidney disease, liver disease, obesity, and certain medicine. So what are the critical organs in the body? One is the cardiovascular system, the other kidneys, nervous system, eyes. So complication occur, damage to the arteries for the vessels, heart condition, heart attack, heart failure. Or when there is blocking or rupture of the blood vessel in there is resulting stroke. Damage to the blood vessels in the kidney and eyes. So this is the thing we said today. When there is the blood bleeding or there is infection, you get the stroke. So one side there will be paralysis, or loss of consciousness, whatever is there. Similarly, blood vessel to the heart will be damaged. Then heart attack will be there, or heart failure will be there. Once kidney involved with it, one stage, then we will get kidney failure. So effect on the already Dr. Dasgupta has talked about the things, so I do not want to repeat. So he is seeking normally this thickness of the left ventricle it is 0.9 to 1.2, but due to contraction, the hypertension, there is against resistance they have to contract, so the muscle hypertrophy. So the increases. So this you see there is 2 centimeter in thickness, left ventricle. Already it is same bracket. So effect on the kidneys. Already talked about these things. I do not want to. Nervous system, I told you that there is bleeding with the CT scan of the image of the patient who has done and there is bleeding is there. Eyes involvement will be there. You can see that there is different blood vessels are there. There is leaking, the thinking is there. You can see there is magnified leaking. And this you can see there is only spots are there, exudates are there, and there is some hemorrhage results there. You can see the bleeding in the endoscopy. People do the eye exam, we can get it. You can done by physicians or the ophthalmologist. They can tell you whether there is any hypertension, retinopathy or not. Similarly, also the east case of pop is good, and there is no margin is there. So papilledema is there. We tell that is first stage of the. So what is the goal of treatment? So we have to keep the system for less than 140 and diastole to less than 80. Our patient with diabetes or diabetes, the basic goal is not 130, this is 125 by 75. It is earlier rather, now it is coming down, it should be 125 75. The primer should be on attaining this systolic blood pressure, and so that you can reduce the cardiovascular and renal morbidity and mortality. So it is already covered up. So this is the dietary advice, what you tell, you go for these things. Getting regular aerobic exercise, that is this squatting at least 30 minutes daily. That is quite important than the running, jogging or bicycling. If you can do it, it's well and good. And losing weight if you are overweight or obese. That's diet. And you should reduce your sodium intake also. Quit smoking. Smoking is quite important. For this causing heart attack and hypertension should be stopped. Alcohol, it is to be taken in case of the male person, they can take up to 1 to 2 packs. That should limit that. For the ladies, it will be less than 1. Sir? Yes, sir. There is a diabetic, welcome diabetic. Dietary approach to stop hypertension. Yes. So this is diet rich in fruits, vegetables and low fat, dairy foods, and substantially lower blood pressure in individuals with hypertension and high normal blood pressure. So this is the gas diet. What should be given? That is 7 to 8 servings of grains and grain products, 4 to 5 servings of vegetables, 4 to 5 servings of fruits, 2 big servings of the low-fat dairy product, 2 or low serving of meat or poultry and fish, 2 to 3 servings of fats and oils, not seeds and dry fruits is equal to 5%. Limited sweets, low in height. So what are the contents? Which contains a lot of sugar. We usually pronouncing and our children they also prefer to take this thing. That is these potato chips, wafers they will take. Pretzels, salted crackers, biscuits, salted biscuits, pancakes, fast foods, pickles, soya sauce, cardboard, cheese, and commercial prepared soups or soups. So reducing sodium in the diet when available by low or reduced sodium or low salt added version of foods like canned soup, canned vegetables, vegetable juice, cheeses which is less low in fat, condiments like soya sauce, crackers, and snack foods like nuts, processed lean meats. So lifestyle change is reducing weight, decrease time in sedentary use. That usually our people they do it either they watch the TV or doing the computer games this for hours together, which should be discouraged. And increase physical activity such walking, that is very good, biking or aerobic dancing, tennis or soccer, basketball, golf, these things are there. Decrease portion size of meals and snacks. So it has been covered by the Dr. So what are the frequent aspects? So what is hypertension? How dangerous hypertension? It kills silent killers for good reason, contributes more than 9 lakh deaths in history and globally. Affects more than 50 million worldwide, is on the rise, increasing 35% in just 10 years from the late 1980s to the late 1990s. Cost more than $37 billion per year in Asia. Dodge alcohol intake affect hypertension. Despite how relaxed you may feel after downing a flu or flu, alcohol actually raises problems. Still yet you can take, if you want to take, I told you can take 1 to 2 days in case of male persons, for ladies less than 1. What factors increase risk of hypertension? Several factors for high blood pressure. Some of these factors include heredity, age, weight, because this is hereditary disease also. Somebody father is suffering, they may not give it to their children, the parents, they will give the property of the hypertension. So does that you have already told? Potassium, yes, potassium helps to protect. So hypertension is silent killer. There is so great awareness should be there for the control how to control the blood pressure, but is to be taken, and modification of dietary habits, regular physical activity, maintain healthy body weight, avoid smoking, use of antiable drugs prescribed by the doctor, and meditation and which already are because then stress is the thing. So that is acting for
Thank you, Dr. Patnaik. I think he has nicely covered all the issues.